Now, patients at various public hospitals remained stranded for the second week as healthcare workers ditched hospitals for the streets, demanding the government addresses their welfare. The protests continue amid mounting pressure to unlock the stalemate and end the suffering of patients. This comes as the clock is ticking towards the 14-day deadline by the Kenya Medical Practioners and Dentists Union, who suspended their strike notice by 14 days to allow for talks with government. Caroline Kamau examines the situation across the country.
This was the situation in the streets of Nairobi Monday. Striking medics under the Kenya Union of Nurses and the Kenya Union of Clinical Officers keeping off their places of duty to demand what they term as a safer environment both for health workers and patients.
We are searching numbers of medics who are getting infections. Then we infect the patients who come to us. They infect the community. We infect our families. And in turn they infect the community. Right now, the super spreaders of COVID-19 are medics because of lack of PPEs. So we are not doing this for ourselves. We are doing this for the sake of the country.
At Kembu Level 5 Hospital, this was the situation. Patients left stranded with no medical personnel to nurse them back to health.
Wakati hapa tuko wengi tumetibua nusu. Pia tunaambua tuondoke tuende manyumbani, na wale ambao hawana mapesa tuko na shida mingi sana. So kitu ya kwanza ningeomba serikali iangalie kuhusu afya.
Christine Moene's 20-year-old son had a road accident last month. His feet were broken and he underwent an operation. He now needs metal plates fixed, but there's no help forthcoming as the medics continue to pile pressure on the government to heed their demands.
Niliombwa shilingi 10,000 nikapeana nikauza mbuzi wenye nilikuwa nao wawili nyumbani, na sasa sina lolote. Na kupeleka mtoto wangu nyumbani Kitui, sina pesa za kumpeleka, hata ambulance sina.
In Bungoma, health workers stormed the streets of Bungoma town, paralyzing business along the CBD, demanding the county address their grievances.
Zaidi ya maafisa 27 wale nurses, tuko na maafisa 7 clinical officers, tuko na maafisa 7 laboratory technicians ambao wameathirika na ugonjwa wa corona. Kwa hivyo jambo la kwanza ambalo tunaandamana ni kwamba tupate kupewa personal protective gear za kutosha ienee katika maeneo yote ya mashinani ya vituo vya afya.
It was the same script in Nakuru, with striking medics holding protests outside the governor's office. They have accused the county government of giving them empty promises. In the capital, the medics' national unions marched to Afya House and later to Parliament, where for the second time they presented their petition to Parliament.
Sad wakati tulianza tarehe 15 mwezi wa 3 2020. Wakati the first COVID case was reported in Kenya, the president among the contained measures was risk allowance to wauguzi ambao walikuwa wanaitwa frontline workers. Hata ilikuwa wakati huo mlikuwa wamesema ya kwamba nyinyi ndio kama askari. Lakini kitu yenye nashangaza kwa hii serikali, unatumaja askari bila bunduki. Na nyinyi mlikuwa mmeitwa frontline workers.
The health workers' strike entered its 8th day on Monday as the medics seek to push the government to provide adequate PPEs to allow for all officers categorized as vulnerable groups be exempted from active frontline duty, a comprehensive medical cover, promotions, redesignation and harmonization of health risk allowance, among others. Caroline Kamau reporting for Channel 1 News.